This is ZengoMD, and today we're going to tackle another topic in medicine where we rethink a very popular and legal treatment option. In part one of testosterone pellets for men, we're going to look at the evidence behind this treatment. First, please read our disclaimer, because chances are you're not sitting in my office right now watching this before your appointment, meaning this clip is not medical advice, nor is it intended to diagnose or treat you. This material is also prepared in conjunction with PracticalCME medical training, which has trained providers in BHRT testing and treatment since 2008. So hormone pellets that contain testosterone are used by men of all ages. They can be the FDA-approved product called Testopel, which is a 75 milligram pellet. Of course, multiple pellets are placed at one time. Or like these, which are compounded at various private pharmacies around the country. Both are simply testosterone with a little binder. There is no proprietary slow-release technology in here. Then they are surgically implanted into your fat every few months using a large bore 4.5 millimeter trocar. They will dissolve under the skin and release testosterone in the venous blood. They're typically replaced every 4 to 6 months due to the cost and inconvenience of the insertion procedure. How big is this trocar? Well, if you took 7 of the most commonly used blood drawing needles for venipuncture, lab testing, edge to edge, you will equal the diameter of one of these trocars. Therefore, a wonderful experience like this is not something you want to do often. Keep in mind as we proceed that both dose and pellet interval can make a big difference, though, in your symptoms and side effects. Pellets are heavily marketed and touted by providers to treat many common symptoms attributed to aging or low testosterone. They're even used in women. You saw estradiol pellets even on the last page in that picture. We even have franchise pellet clinics like BioTE recruit doctors and help them set up pellet practices. They've even invited me to a couple of dinners. I haven't gone, but they're national. So let's see if we can learn a few things from their website. First, their hormone therapy page has the word pellet mentioned 24 times. So it seems like they're all in for pellet therapy. Therefore, this should be a good place to find out about all the research regarding pellets. Now let's go to the benefits page. Surely we will get some really good evidence for why getting stuck with a trocar is better, right? And sure enough, the word hormone appears 42 times. Looks like we're in business. The benefits page also mentions the word replacement 13 times and balance 10 times. But just remember what balance really means. In order to balance something, you need to know what the opposite force is doing first. Therefore, we get an impression that pellets are bioidentical. And we have a video on the definition of bioidentical you can check out, or watch part 2. And these things replace what is missing to restore balance. That's the impression I get. I don't know what you get, but let's now search for the word pellet. Oh, snap. It only appears once, and that is in the footer. And these people sell pellets to providers. So why do they not want to talk about them here? There's nothing in the body text. That seems strange. Well, I still want to learn about the benefits of testosterone pellets. So maybe they just have some comments on the benefits of testosterone in any form. So let's look for that word on this page. Nothing. Is this the same website as the one that mentions pellets on their homepage? Are these the same people that talk about testosterone pellets at medical trade shows? Because the benefits they are quoting did not involve the use of pellets or testosterone on this page. Well, they know that, and certainly they don't want to make false claims on their website. They are simply making general statements about all different kinds of hormone treatments that exist. Pills, patches, or gels are included in this data set that may bear no resemblance to the dose and pharmacokinetics of pellets. Let's search PubMed for the phrase testosterone pellet, and maybe we can find them a really good paper on testosterone pellets that they can use. So we get 37 studies over 70 years, and we have a few case reports of complications. An article here on insertion techniques. We'll see a lot of those. Number 9 is a good review article that we're going to discuss coming up here soon. An article about adding another drug to make pellets possibly safer. And yeah, number 10, another one on side effects. Another one on technique. And one tiny little single site study about safety. It only ran a short time. More papers on side effects and techniques. Now we're all the way back to 2003 already. And we'll go here to the next page, but still, we've gone back a long way already. Trying to keep pellets in and not extrude. That was a problem back then. It's not as big of a problem anymore. And now a few bad studies on animals back in the day. And now we're already back in the 1990s and earlier. And a couple more general things, but no large-scale trials, no long-term trials. And here we go all the way back to 1946. So 1975, 58, 46, and we're done. Search testosterone pellets, plural, and you get 81 results, but it's still the same general distribution. More articles on insertion technique and case reports of side effects, with no trials that compare pellets to gels and no trials of any size that follow levels and biomarkers after many years. Testosterone pellets were FDA approved in 1972, but were not readily available until 2008 when they were marketed as the current Testopel. This review article notes that there were virtually no data on the pellets, and much of the data that won FDA approval in 1972 was extrapolated from the data on injections. No pharmacokinetic studies on pellets were done prior to 2009, yet this product was approved, shelved, and reintroduced without a lot of challenge. In a study of 15 men in 1988, testosterone levels skyrocketed to 3 times normal in a few weeks before slowly returning to baseline. And then in a follow-up study, they found that testosterone levels again peaked at 1 month and decreased proportionally to the drop due to the drop in the surface area of the pellets. And that drop was pretty fast. In 1996, it was noted that estradiol levels in men peaked at around the 42-day mark, which is about 1 month plus 10 to 12 days. Remember, these are men, and men don't need excess estradiol, since it is implicated in many cancers, and that estradiol was shown to spike shortly after the testosterone peaks, indicating we are metabolizing that excess testosterone down a really bad secondary pathway, which can happen when you overload the primary metabolic pathway. Another here that shows the exponential decay, and no matter how many you insert, you just increase the peak, not the duration of the effect. So no long-term studies, like nothing over a year, and that's really like doing a study that shows that only 15% of marriages end in divorce. But the study ends when they're only married 2 years. Is that really a good study? And there could be scarring with repeated insertions as well. Well, this chart here involves some simple 10th grade math, volume and surface area of a cylinder. So take a 9 by 3 millimeter pellet. Now decrease the dimensions by only 25%. That actually drops the absorptive surface area by 43% and the reserve volume left over in the pellet by 57%. When the pellet dimensions are halved, it is pretty much spent with only a tiny fraction of its surface area and volume remaining. More evidence about how levels can peak early at multiple times physiologic and then decay quite rapidly and exponentially. Please come join us for part 2 of our series on testosterone pellets, where we go into more detail about how this peaking and crashing of the levels can affect receptors, symptoms, and side effects. See you there. Bye.